What a rich conversation. Um, yeah, I'm soaking it in, and I am making all kinds of notes and questions for the panel this afternoon. So hopefully you are as well. I just really appreciate the thread that we're hearing, that in order to think about the healthcare system, we can't think about the individual's health, but have to think about our health in community and the connection to, I think, Dr. Smith, you said that we have to think about the connection between a healthy mind and a healthy society, and that those things have to be conceived and faced together. Really important, so thank you. Just want to give a little disclaimer. We started about 15 minutes or so late. That's no problem. I don't want anyone to panic about that. We'll make that up over lunch. We kind of padded the time in the lunch. So we have one more incredible speaker, and then after that we'll do some announcements and think about lunch. But please let me introduce Dr. Curt Thompson, who is a board-certified psychiatrist, author, speaker, and co-host of the Being Known podcast. He has been in private practice for over 30 years, close to here in Falls Church, Virginia. He graduated from Wright State University's Boonshaft School of Medicine and completed his psychiatric residency at Temple University Hospital. He strives to help patients develop flourishing lives by telling their stories more truly, to become more deeply known, and to create beauty and goodness in the world. With conviction and humor, he trains clinicians and speaks at workshops, retreats, and conferences, integrating neuroscience, human relationships, and the Christian faith. His latest book is The Deepest Place, where he asks whether it is possible to live with hope in the face of personal and global suffering. Important question. He and his wife Phyllis live outside of Washington, D.C. and have 2 adult children. Please help me welcome Dr. Curt Thompson.
There we go. Here we are. Okay, it's really difficult to be me when you just had these 2 preachers preach. Okay, so please bear with me. Okay, thank you. And I think the other thing I want to begin with is to say, I think when we gather in these, we come to these gatherings, and we often imagine, and rightly so, that we are going to hear information. And it's my hope for us also to be attuned to the fact that the most important thing that's happening in the room is the question of what is the Spirit of God doing within and between us? How is God forming us, not just what is the information that we're receiving? Also, I tell people when I'm training clinicians especially, which often doesn't make people happy when I tell them, look, when I'm done, you're not going to be much smarter. Like, so why did we pay to come to the conference? Because our job is not to make you smarter. Our job is to inspire all of us, myself included, to go home and do the work. And I will already say that the Spirit has been moving within me, listening to what you've been sharing. My experience is not just that I've heard 2 people talk about information, but I've heard you offer us yourselves as well, which has been already provocative for me in the best kinds of ways. So in my time and reflections, I want to just invite us to imagine the notion of just healthcare. And I want to begin with a story. And it's the story of what it was like for me to train in North Philadelphia in Temple University Hospital's healthcare system. And I was in my mid-20s when I started there. This is in 1988. And trained from 1988 to 1992. It was the height of the cocaine crisis on the eastern seaboard, especially in Philadelphia. We had our own psychiatric emergency room all set aside for all kinds of things that would come into the room. But, one of the other things that happened would be we would see lots of, even though I was a psychiatrist in training, I would see lots of people who had multiple medical conditions who were also coming into our psychiatric clinic. And one of the things that I at least noticed, we had in North Philadelphia, there was a significant African American, Hispanic American populations. And one of the things when we would do, a medical workup along with a psychiatric workup, and we would notice that especially, and this particular epidemiologic reality always came to me, is that almost all the African American men that we would see would have hypertension. And it was even my young, naive, medically trained self, but especially the young, naive portions that I would describe, was already asking questions. Why is this? And of course, when you ask these kinds of questions, the answers that were given to you were all of the demographic and epidemiological scientific data. So I just want to hold like that. This is how the question was formed, and this is how then the question was answered. And I found that to be a curious thing, and it wasn't even until later, long after I was at Temple, that it began to dawn on me about the things that were really going on in this medical community that actually were not being effectively addressed by medicine. The questions that would have necessarily needed to have been posed were not the ones that were being asked, and hence the answers that needed to be given were not even a possibility. And it wouldn't be strange to say, well, and if let's consider who are the people that were in charge of the centralized Temple medical healthcare system that sits on North Broadway. It's not a group predominantly of African American and Hispanic people. It's somebody else who comes from a scientific training. Not that any of that is morally wrong or bad and so forth, but it means that there are certain ways in which the world is understood, that human beings are understood to be, such that certain questions are the ones that we ask, which means we will be limiting our answers because those are the questions that we ask, and those are the questions that I ask. And others may ask very different questions, the richness of which we've already been hearing. What are the kind of questions that we ask? So I want to hold, and that awareness of that demographic was one of many that haunted me, because it felt I felt like we were so insufficiently responding to this. Now, I had been, when I was in medical school at Wright State University, I was part of the Christian Community Health Fellowship, made a number of trips to Lawndale Christian Healthcare Center in Chicago, was deeply formed by that tradition. And as I entered into psychiatry, I was also asking the question, how do we do this work well in this field of mental health? How do we do that? And it was, I think I wasn't even aware of the fact that this sense of being haunted by these things that I was witnessing even in my residency training program, it wasn't even clear to me yet what was trying to get my attention. It's only later that it became more and more clear to me about what was happening. I want us to just sit with that story as the beginning of asking, just being curious about what do we mean by just healthcare? We've heard elements of that so far, and I just want to invite us to consider a couple of things. The first, when we use the word just, we've heard explorations, elegant, erudite explorations of what we mean by justice. And I would say, in one way to talk about justice is that it is, when we talk about individuals, interacting with other individuals, when you and I are talking to each other, when we're living together as individuals, whether it's in our kitchen or in our neighborhood or in our churches, I want to be a person that lives the Sermon on the Mount, and I want to be a person who bears the fruit of the Spirit. That might be shorthand for that's what interpersonal behavior looks like. And what we would say that justice is the sermon on, again, this is, I'm not a theologian or an ethicist. Justice would be, it's the Sermon on the Mount and the fruit of the Spirit embedded in our social structures. This is what justice looks like. not just between lots of people who all look the same, but structurally. But it's not going to happen structurally if those individuals are not reflecting and thinking about what it means to be living, breathing, embodied Sermons on the Mount, fruit that's being born. Does that make sense? What's healthcare? So let's just imagine that we're going to be living, breathing communities of Sermons on the Mount and the fruit of the Spirit, which means we're taking care of the poor, the lost. All of that's taking place because this is what it means to do those kinds of things in a structural setting. But what is healthcare? Now, as a psychiatrist, in training, now this might be odd to imagine, but in my medical school training and in my residency, not only did I not have a course, I did not have a single class, a single lecture to answer the question, what is mental health? I have libraries that tell me what mental pathology is. Nothing tells me, what does it mean for us to be actually healthy? We often think about it as it's the absence of disease. That's the best that we know how. Now, if you go to an orthopedic surgeon, you would hope that they would know what an osteocyte looks like. You would hope that they could tell you, oh, this is what a femur looks like when it's healthy. You come to a shrink and you discover, oh my gosh, he knows all about the DSM, right? Are you familiar with this? But what is mental health? And I want us to consider that we live in a world that in the first place is in our embodied relationships and our embodied imagination. First of all, don't really in embodied ways know what justice is, and we don't know what healthcare is. I know what disease is. I know what things are when they're wrong. It's hard for me to have the embodied, felt sense in my chest of what's happening with me in the room when justice is taking place. I have a hard time understanding what healthcare is when I see it. We aren't taught this. We're taught what it means to prevent disease. Are you with me so far? Okay. So, I want to invite us to consider that then one of the most important reasons why we don't know these things is because we live in a world that answers this question, what does it mean to be human, in ways that we've already heard. And the answer to the question, what does it mean to be human, to live in the 21st Western world, is that we are machines. Now, nobody's going to teach your kids this in third grade. They're not going to say to you, you're a machine. All right, they're not going to say that, but that's how we are going to be treated. The cartoons about the automobile, right? The notion that I'm going to have my front end loader in the hospital bed. I am a machine. This whole notion that this is what I am is in the water we drink. It is in the food we eat. It is in the conversations that we have, because it is how we are implicitly treated. And what we are saying as Jesus followers is that we aren't machines that are just waiting until our time is done and then we go to the next machine version, right, just to get an upgrade on my computer. We're not machines, but I want to assure you it's really difficult for us to live believing otherwise, because the implicit, embedded message has been around for a long, long time. So we don't even know most of the time when it is that we are living like machines. Now, this comes through in medical training all the time. We've already heard the complaints about what happens when someone, when someone doesn't get enough time with their doctor. And they will say, I don't have enough time with my doctor. And the doctor will say, I don't have enough time with my patient. And that's because we're trying to treat machines. And we have lots of machines to get through. When I was a resident working in community mental health care, I was seeing 40 patients a day. And you're wondering, gosh, and you're like, gosh, this is great because you're getting through all these people. In this room, you're like, what? Like, how does one psychiatrically engage anybody? Like, in fact, if we were machines, like, that wouldn't even be enough time to take care of all the machines. So this is the first thing I want to invite us to consider, that we answered this question differently. We answered this question by saying, oh, we are image bearers. We answered this question by saying, we are embodied and breathed creatures, right? That the Lord God formed the man from the mud of the earth and breathed the breath of life into man's nostrils. Man became a living being. But we are also that's not just who we are in terms of how we operate, as we've heard so far. When you read the first page of the Bible, you recognize that to be on this earth, we are given a mission. Our mission is to create and curate beauty and goodness in the world. And the man and the woman, where they were given this mission to go out and extend the border of Eden. Are you with me? This notion that my work in the world is to create beauty and goodness in the world. Notice with child development, and if any of you have ever had children, and they get to be about 3 to 4 years of age, you notice at some point they're going to start to make stuff, and they're going to bring this stuff to you, and they're going to want you to think it's Van Gogh. And they're going to want you to put it up on the refrigerator and charge neighbors money to come and see it. You don't have to teach them to do this. Children make things, and this is what we are made to do. Our mission is not to keep from getting sick. Our mission is to create and become icons of beauty and goodness in the world. But I want to say this to us. It's not enough for me to hear somebody tell me that that's what I am. I actually have to feel it in my chest that someone sees me as being that. And so one of the beautiful things about the work that we do in this field of interpersonal neurobiology is that it enables us to pay attention to how the mind works, and the really intriguing things that we've been discovering in the last 20 years about this particular scientific discipline is that when we pay attention to the data itself, the data points away from science itself. Here's what I mean. In our working world of interpersonal neurobiology, it's a field of scientific disciplines. It's a collection of different disciplines that all have a stake in answering the question, what is the mind, and what does a mind look like when it's flourishing? And what we come to find out is that in that set of scientific disciplines, we would say that the mind, first of all, is an embodied and relational process. That your mind is not your brain. It's not limited to your brain. It's not limited to your thinking self. Your mind is your entire body. Your brain happens to be part of it. It's an important part of it. But how do I know every time I'm anxious? I know it because I sense it right here in my abdomen. In fact, your bodies in this room are sensing things long before your brain is thinking things. And what I'm paying attention to that I am sensing is largely something I'm not actually aware that I'm paying attention to. Many of us have already resisted the urge to get up and leave and go to the bathroom. We have. We've sensed it, but we've stayed in our seats because our bodies are, now that I said it, everybody wants to go. But our bodies are sensing things. When we talk about justice, we talk about things that my body senses long before my head thinks this stuff. Are you with me? So my mind is an embodied, also relational process. Meaning, a newborn comes into the world. I became a grandfather 4 weeks ago today for the first time. 100 billion neurons, and of those neurons, what a baby comes into the world with, only about 15 to 20% of those neurons are able and ready to do what that newborn needs them to do on their own. The other 80%, in order for them to come online and to do eventually what they're going to do when they can bring you Van Gogh as a 3-year-old, those neurons need an interaction with another human being. It's not good for the man to be alone. And so we see in the neuroscience itself, we're already reading a recapitulation in the first 2 pages of the Bible. That we were made to be creatures who are making things, creating and curating beauty and goodness. But the interesting thing about this is that this process for me to become an integrated mind actually requires the presence of somebody else to be in the room. Not only that, for those parts of my mind that are not always easily functioning, the parts that I would much rather get rid of, I actually doubly need the presence of somebody else in the room to come help me find them. My wife, a social worker, recently retired, child development specialist, likes to say this about children. Children are expert observers. They sense, see everything. They pick stuff up long before their parents, like their kids. It's like, Mom, Dad, like I think you got marriage stuff going on here. I don't know if y'all know this or not, but I think you need to go see somebody. But here's the thing. She will also say, my wife will also say, children are horrible interpreters. They observe all kinds of things, but then they are left to make interpretations about these things unless they have another brain that's in the room. But here's the other thing about this. In order for my mind to flourish, I need somebody to be in the room who's not just separate from me. I need somebody to be in the room who is different than me. When we read the 2nd chapter of Genesis, and the man and his wife were naked and unashamed, the whole notion of male and female is not just about gender. It is a calling card. It is a clarion call to differences in all kinds of ways culturally. Are you with me? I do not know who I am as a middle-aged white dude if I do not have an African-American woman in the room. I do not understand my story if I do not have somebody else in the room, especially those who are demographically, economically, culturally different than me. The God of justice is not just one who cares about the poor and the least and the lost because we need to take care of them. It is because in the interacting with them, I, who am on the higher side of the power gradients, get to become more of who I am going to become. I cannot become my full self if someone who is not really different from me, if I'm not interacting with them in an intimate way. Does that make sense? Now, here's one last thing that we would say about who we become as humans. So with this whole notion of we are embodied, we are relational creatures that move toward integration when we do the work. I'm going to have different parts of me are going to come together, what I sense, what I image, what I feel, what I think, what I want to do with my body. All of that depends a great deal on my being integrated with others. All the different parts of me can only come together effectively when those parts of me are with someone else who is also different from me coming together with me. But cattle do that, as it turns out. Other non-primate animals do all kinds of things that humans do. But there's one thing in particular that humans do as we emerge into maturity. We tell stories. Now that's like patently obvious. You're like, well, okay. I realize that we're the only ones who tell stories, but here's the thing. Most of us are not aware of the stories that we're telling. When I was at Temple, the story was being told is that if you're an African-American male with hypertension, that's because you have weight issues, it's because you have maybe a family history of hypertension, your diet issues, and so we're going to get you exercise. Nobody is telling the story that is a person who lives in the wake of generational trauma. That is a person who's a downstream recipient of epigenetics. That is a person who finds hypertension as the doorway into telling a story about who they are. That is so much more than a list of my symptoms and my physical complaints. Are you with me? I want to invite us to consider that everything that we do by the time we find our first and second and third word is a way for us to start to tell the story. When you read the biblical narrative is a story that God and humans tell together about God's insertion into our lives, eventually culminating with Jesus, who then wants us to be like him and do the same thing he's doing. We are telling stories. When a patient, as it turns out, then comes to see us in the clinic, tell me what brings you in today. Well, my shoulder is really bothering me. Or gosh, I'm finding myself I'm just really tired. If I'm not paying attention as the physician and I only have 10 minutes to be with this patient, I will think that the only part of their story that they're telling is that they're tired, that they have a shoulder problem. I'm not listening. I'm not sensing. I'm not feeling the backdrop of the story that they are trying to tell me. Now, of course, and if I don't have enough time because I've got to see my 30 patients today, somebody's story is going to be told very incompletely, and you know what happens when you make decisions about anything in science with incomplete data. Things go south in a hurry. And this is essentially what we do. Because we do not pay attention to who we really are as human beings, because we think we're machines, not human beings, we are making decisions with incomplete data. What we really want to be, though, are people who are telling our stories more truly. And by truly, I don't just mean that we're telling the truth versus falsities, facts versus lies. I mean, we want to tell our stories faithfully. I have a patient I've been working with for over 15 years. He first came to see me because he was having a great deal of anxiety. And this is a person who, when he came to see me in his early 40s, had bought and sold 3 companies by the time he was 35. And most things in his life were such that when you look at the story that he tells, one doesn't have an easy route to understand why this person's anxious. And you ask in, psychiatric workups, medical workups, you're asking questions like, well, tell me, what was it like growing up in your house? And he said, well, I grew up in a loving Christian home, which, as we all know, is like code for, life actually was really hard and it sucked at times, but you just can't tell that to anybody. Right? This is I grew up in a loving Christian home. And then, of course, you ask the next natural question, who was in charge of discipline in your house? It's like a fun question to ask at a cocktail party. Just imagine if you're at a church gathering, you're like, you ever have lunch at church and you're running out of things to say. Who was in charge of discipline in your house? And he says this. He says, I guess that was my mom, because anytime my father got involved, who was a deacon in the church, anytime my father got involved, things became violent in our kitchen. Now one wonders, I just asked you, what was it like growing up in your house? And you tell me a particular story. I ask a different question, and the story, as it turns out, is anything but the story you just told me. And most of us, even in this room, have parts of our stories that nobody else has heard. And that becomes like the poor, the lame, and the lost that are within me that have not yet been found. And we can talk about all the things that we need to do to bring justice to bear. And I will tell you that if I am not having experiences in which that same phenomenon is happening within my own mind, you cannot pay me enough money to get me to do it in the world. Does that make sense? And so we want people to be telling our stories more truly. So what I'm really hoping for, and when we head to our conversation, is to be asking, what does it mean for us to tell our stories more truly? In San Antonio, the H.E. Butt Foundation is doing remarkable work in bringing communities of disparate backgrounds together to have conversations, storytelling conversations. And when people are around the table who have suffered, and generations ago suffered from the hands of people who are with the grandfathers of the people who are in the room. And I am now hearing your story, and you're not just giving me a checklist of symptoms. Your telling your story of suffering actually touches the parts of my story where I am suffering, and I happen to have enough, accessories to keep me from knowing where I suffer. Does that make sense? We've named this already in some way, how we find ways to just keep myself unaware of myself. And if I can keep myself unaware of myself, I can keep myself unaware of you. Which is why I'm saying, I don't know who I am until I see me in your face. So what does this mean then to tell our stories more truly? In our practice, we have developed, and we can talk more about this, these confessional communities that we've developed in our practice, but that are now kind of being exported into other communities in which we have a particular storytelling liturgy and a way in which we go about do this and structure this such that people are able to vulnerably reveal who they are to people who are very much not like them, such that the parts of them that they didn't know are now in the room, that enable them to relieve that energy. We burn a lot of energy containing our shame and our trauma. We burn a ton of energy doing this. And most of the energy that we're burning doing that, we don't know we're burning until we're no longer burning it. And suddenly, we find ourselves waking up to energy that we didn't know that we could have in order to then take the risk of launching out to create those opportunities for beauty and goodness with the least and the lost. Because I now have the courage to do this because I recognize that I'm not ever going to. Human beings do not do things because they make sense. We make sense of things that feel right. And if it means, if seeing what Jesus does and having me wanting to do that is going to be a direct function of the degree to which I have the experience of someone coming to me as Jesus comes and finds parts of me that I don't want to talk with you about, and to find that once those parts of me are in the room, you have not left the room, but like the Good Samaritan, comes, finds, binds up the wounds. This enables me to know that, we can do hard things because I'm not by myself. It's not good for the man to be alone. We've said this, it's the most haunting line in the entire first 2 pages of the Bible for us. We live in a world, because we believe we're machines, that thinks, even those who are not believers, that thinks that the world begins in Genesis chapter 3. Without being aware that it begins 2 pages earlier. And God's mission for us to become queens and kings in the world, to rule with him, hasn't ever changed. Jesus is just the first person who tells us how to do it. My invitation for us, as we enter into, and my invitation is for us to consider, that as we go on to do the things that my colleagues have named that we would be good for us to be doing, that my likelihood of being able to pull that off is going to be more likely if I am in a room with other people who are not like me, who are giving me the opportunity to be deeply known, and they the same, such that we collectively then go on to create the beauty and goodness that looks like justice. Because what I think we're really doing at the end of the day is this. I think we're practicing for heaven. Dallas Willard, who is a name that some of you may be familiar with, I was in a lecture when I heard him say, God will let anyone into his heaven who can take it. And I think that heaven is a benchmark that I have to reach. And what the biblical narrative would suggest is that Jesus is trying to turn us into the people who can tolerate the kingdom when it shows up. And that kingdom is a kingdom in which I'm going to need to look forward to and look for ways to be with those who are different than me. But I can't do that very easily just because somebody tells me to. I do that in response to someone coming to find me in those places within me that need the same thing. And to the degree that we do this, we practice for the heaven such that when it shows up, We may be overjoyed, but we won't be surprised. Thank you for your kind attention.